Health Canada is soon expected to make a decision on approving a third COVID vaccine, the Oxford-AstraZeneca shot. The federal government has secured 20 million doses. New research out today suggests the vaccine doesn't just limit severity of viral symptoms, but also limits the transmission of the virus itself. At the same time, the vaccine is also facing criticism over the lack of data collected for older adults. Earlier, I spoke with Professor Adrian Hill, the director of the Jenner Institute at Oxford University. He's also one of the researchers involved in discovering this vaccine. I asked him what exactly the new data says about transmission.
There are three things you might like a vaccine to do: stop severe disease and death. All of the licensed vaccines do that really well, over 95% efficacy, including ours. Then the second measure that's most commonly reported is what does it do against mild or moderate COVID, symptomatic episodes that don't end you up in hospital. And there the numbers vary from 60% to 95%. But what you very seldom see reported is efficacy against transmission, because there you have to swab the nose and throat of thousands of volunteers. We had about 12,000 in our trial in the UK every week for months and months and months, have those swabs sent in and analyze them. And you get a measure of whether the vaccine is stopping people being infectious as opposed to unwell, infectious to other people at a time when they're asymptomatic. And we do now have a read on that, and the overall efficacy of our vaccine against transmission or being infectious, as determined by a PCR test, is about 67%. So it's great to have that read on at least one vaccine showing that COVID vaccines can prevent people being infectious.
And that's pretty significant. I mean, I remember listening to public health officials in this country often talk about how that evidence was so far missing. They're waiting to see, because that would be one of the key determinants in when restrictions can be lifted and things along that line. How significant is it from your perspective to see that result?
We think it's really important. As you say, it's something the public health officials have been waiting for. It's also particularly important if you're vaccinating younger people who tend not to get so unwell or unwell at all, but can often be infectious and transmitting to their families and people they meet without knowing it. So I think this really enhances the case for vaccinating all over 18-year-olds to prevent transmission predominantly in the younger population, and of course disease and death in older adults.
Let me ask you a follow-up about older adults, because I know our viewers have expressed some confusion about some of the information they're getting where this vaccine is concerned and people over 65. Swiss authorities, for example, withheld their approval today of this vaccine, citing lack of data in trials in older people. France said that it won't use the vaccine for people over the age of 65. Can you explain for us? I know that there's I guess the concern is around a lack of data in that age group. What can you tell us about that?
Yeah, so the background here is that many vaccines are not tested in every subgroup of the population that you would like to see efficacy in every ethnic group and every age group. And they tend to be licensed then on good efficacy in a major group, say 0 to 7 or 18 to 70-year-olds in this case, where if you get good efficacy in that group and an immune response that you can demonstrate is induced equivalently or to a higher level in the other population group, then you issue a license for all of the populations. And that's why the European Medicines Agency, which has 27 member states, all of whom voted unanimously to approve this vaccine for all individuals over 18 years of age. The same happened in the UK, of course, as well. But that's relying on immunogenicity. We also have data coming, the numbers are fairly small, on efficacy in older adults over 65 years of age. At the moment, there are only 10 of those cases that were reported until early December when we had our last data lock. 8 of them were in the control group and 2 in the vaccination group. So that's clearly trending in the right direction. There are more data already. We're now nearly 2 months later. There will be a lot of data from a US trial that has fully recruited about 35,000 people. And there are data from passive surveillance of millions of people in the UK, mainly older adults who have been vaccinated with the same AstraZeneca vaccine. So more data are coming in very quickly. I think the age issue will be remedied very soon in the small number of countries that have not given a full age range licensure.
We're still waiting, final question for you, Professor, in this country to see what the approval, the approval comes and what it looks like. Do you have any expectation on a timeline? We were told at some point late last week it could be coming in the coming days.
That's exactly what we were told, so we will wait and see. But yes, it could be soon.
Okay. Thank you so much, Professor. Appreciate your time this evening.
Thank you very much.
Hi, I'm Vassy Kapelos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.